Okay, so my patient is coming in for their first appointment, and we're going to perform a biopsy while they're here and look at the problem area of the skin to try and determine if they have skin cancer or not. Hi there, I'm Sydney, and I'm going to be your dermatologist today. So why don't you go ahead and sit down and tell me what's going on? So I see that you have this spot here. I'm gonna just look at it for you. It looks really scaly, like and a little bit raised and puffy. So what kind of what is your knowledge of different skin conditions, and do you have an idea of what this might be? So maybe you know a little bit about different types of skin conditions that this could be. It hasn't been healing up, even though it's been several months that this has been on here. So I'm going to talk to you a little bit about the possibilities of different conditions that you might have. I think we're going to go ahead and perform a biopsy on you, which is we're just going to take a little bit of the skin, a little sample, so that we can do some tests and just try to rule out any diagnoses for conditions that you would not have, and also just to know for sure what it is. So you're going to go ahead and say here, we'll take the skin sample and send it off to get it tested. And while it's getting tested, excuse me, I want to go ahead and ask you, so what do you think this is? You think maybe it's some sort of fungus or growth. I don't think that's what it is. I think that we have a skin condition that really fits this description. It's not something that you need to be nervous about, because we can, and it depends on what our tests come back as. I could be wrong, but I think that you have a skin condition of the squamous cells in your skin. The squamous cells are the cells that make up one of the topmost layers of your skin, called the epidermis. And those squamous cells, occasionally, especially if you've been in the sun a lot or have been tanning, have you done a lot of that? Yeah, so it's nothing to be super worried about, but I think that you do have a condition that we call squamous cell carcinoma. And a carcinoma, although you don't need to be overly concerned about this, we do have to remove it, because if it continues to spread, it can cause a lot of other health problems. A carcinoma is actually technically a type of cancer, although although this is clearly in its early stages. And so if our biopsy comes back with the results that say that that is really what it is, all we're going to need to do is just remove that. And we can do that with a number of procedures. We can either use a freezing procedure to freeze the growth from your skin and remove that, and then we'll just have to stitch you back up and and then cover that wound, and then you'll just need to perform regular skin checks to make sure that you don't have any other skin conditions popping up, and come back to the office for a regular examination, where we'll just look you over head to foot, like I'm going to show you how to do to yourself every few months or even weeks if you want. You want to look through your whole body, head to toe, all areas, just to make sure that there's nothing that's strange or misshapen, no spots or flakes or areas of the skin that look abnormal. So what we're going to do is we can either freeze the carcinoma from your skin, or we can go ahead and perform a surgery where we actually cut that part out. And then we can, there's a few other options as well. We can perform a Mohs procedure. Because it's on your face, we might want to be real careful with that area and perform a Mohs surgery, which is basically the same as cutting it out, except that you use a microscope so that the surgeons make sure that they don't take any area of your skin that they don't absolutely have to. It's very precise. So that would be a good option for you. Basically, and after this surgery is complete, I would just want you to make sure that you take good care of that wound, that you perform regular examinations, and um, that you make sure that you avoid bringing on further growths by staying out of the sun unnecessarily, by using plenty of sunscreen, covering up when you go out into the sun, things like that. Probably avoid tanning beds. Or if you work with x-rays or anything, to possibly try to minimize the amount of radiation that you're getting. So yeah, if your results came back and they say that you do have a a squamous cell carcinoma, and so we'll go ahead and cut that out. The other different types of skin cancer that we also want to look for are things like basal cell carcinoma, which is very similar, but it looks totally different. It has a different appearance. The appearance of basal cell carcinoma is it often just looks like a sore. So it's something that it looks like you just developed a sore or a scar or a scab. Another form that you also want to watch for, which is much more serious, so just be aware, and it can also show up around moles or freckles or other areas that are pigmented, and that's called melanoma. So that's a third type of skin cancer that if you see one like that, which would often be a darkened area with an irregularly shaped border or just anything that looks out of place on your skin, that is something you'll need to come in for right away, because that can be extremely dangerous to leave that on, um, and it needs to be removed right away. All right, so thank you for coming in, and we'll get you taken care of.